In this e-learning segment, we'll take a look at a general overview of EHR data reporting requirements set by the Centers for Medicare and Medicaid Services, or CMS. Required reporting of EHR data was introduced in 2009 when the Health Information Technology for Economic and Clinical Health, or HITECH Act, was established to modernize the healthcare infrastructure across the United States. Included in the HITECH Act was the introduction of the Medicare and Medicaid EHR incentive programs, commonly referred to as the Meaningful Use Program, to encourage eligible clinicians and hospitals to adopt, implement, upgrade, and demonstrate meaningful use of certified EHR technology. The Meaningful Use Program began in 2011. In 2017, all eligible clinicians who have participated in the Meaningful Use Program were switched to the Merit-Based Incentive Payment System, or MIPS, which is one of the two ways to participate in a new payment structure for Medicare Part B eligible clinicians called Quality Payment Program. At this point, the original Meaningful Use Program only applied to eligible hospitals, and this setup still applies today. As the objectives of the Meaningful Use Program evolved over time, the program's name was changed to Promoting Interoperability Program in 2018 to better align with efforts to improve electronic health information exchange and patients' access to their health information. Here are more details about the Promoting Interoperability, or PI program. The PI program applies to eligible hospitals and critical access hospitals paid under the Inpatient Prospective Payment System, or IPPS. Rules for the PI program are updated by CMS annually. For this PI program overview, we'll focus on the requirements based on the rules for calendar years 2020 and 2021. First, the hospital's EHR must be certified by the ONC, or the Office of the National Coordinator for Health Information Technology. The hospital must earn a total score of 50 points or more, calculated from 6 PI measures. Points must be earned during a performance period of at least 90 days continuous for each calendar year. There are other requirements that do not have any point values, including the submission of electronic clinical quality measures, or ECQMs. The deadline to submit all the PI program requirements to CMS is 2 months after the end of the calendar year. 4 objectives have performance-based measures that count in the overall PI program score. Under the electronic prescribing objective, the e-prescribing measure is worth 10 points. This measure evaluates the number of hospital discharge prescriptions that have been electronically transmitted. A second measure under this objective, Query a Prescription Drug Monitoring Program, or PDMP, is an optional measure worth 5 bonus points. A hospital earns 5 points if they attest to reviewing the state's PDMP prior to electronic prescription of Schedule II opioids. In California, the state's PDMP is called CURES. Under Health Information Exchange, support electronic referral loops by sending health information is worth 20 points. This measure counts the number of transitions of care and referrals where summary of care records are created using an EHR and exchanged electronically. Support electronic referral loops by receiving and reconciling health information, also worth 20 points, counts the number of patient admissions that have electronic summary of care documents received from external organizations and reconciled into the local EHR as appropriate. Under the Provider-to-Patient Exchange objective, provide patients electronic access to their health information, worth 40 points, counts the number of discharged patients who are given timely access to view online, download, and transmit their health information. For the Public Health and Clinical Data Exchange objective, the hospital must submit electronic data to 2 registries or public health agencies. The measure uses a yes-no attestation. Yes earns the hospital 10 points, and no equates to 0. Here's an example of how points are earned for a ratio-based measure. For the e-prescribing measure, the denominator counts the number of discharges with medication orders within the 90-day reporting period. In the numerator, the number of electronic prescriptions is captured for the same time frame. In this example, the hospital had 250 discharged prescriptions and 200 were electronically prescribed. The performance rate in this case is 0.8 or 80%, which translates to 8 points out of the 10 for this measure. And here's an example of how the total PI program score is calculated. The measure scores in the last column are added to get 83 points for the total PI program score, which is above the 50-point mark needed to satisfy the PI program. As previously mentioned, submission of electronic clinical quality measures, or ECQMs, is one of the requirements for the PI program. Of note, ECQM data are captured directly from the EHR and does not require manual abstraction. The required reporting period for calendar year 2020 is one self-selected quarter, then 2 self-selected quarters in 2021. The number of measures required for both years is 4 self-selected ECQMs out of the 8 available options in 2020 and 9 options in 2021. Most of these clinical quality measures are ratio-based, similar to the score calculation for many of the PI measures. ECQM performance for 2020 will not be publicly reported, but ECQM data for calendar year 2021 will be made public through the Hospital Compare website. Submission deadline for ECQMs is mid-March following the end of the calendar year. Now let's talk about the Merit-Based Incentive Payment System, or MIPS. MIPS is a reimbursement structure for Medicare Part B covered services under the Quality Payment Program, or QPP. MIPS is one of the 2 ways to participate in the QPP. The other Medicare reimbursement structure is Advanced Alternative Payment Models, or Advanced APMs. The final rule for the Quality Payment Program for 2021 has not been published at the time of this recording, so we'll focus on the MIPS requirements for 2020 and talk about what's been proposed for 2021. Clinicians eligible for MIPS are those who are reimbursed for Medicare Part B services. For 2020 eligibility, clinicians must exceed the low volume threshold criteria and be enrolled before January 1, 2020. Eligible clinician types include physicians, nurse practitioners, CRNAs, clinical nurse specialists, and many other healthcare professionals. The MIPS final score, which ranges from 0 to 100, determines the Medicare payment adjustment. The performance threshold is set to 45 points, which means that MIPS final score of 45 points is required to receive Medicare payment without penalty. Score below 45 points means negative payment adjustment, and over 45 points lead to positive payment adjustment. Exceptional performance with MIPS final score of 85 points or higher results in additional positive payment adjustment. For calendar year 2021, CMS proposes to increase the MIPS performance threshold to 60 points. The final score is calculated using weighted scores from 4 performance categories: quality worth 45%, promoting interoperability at 25%, improvement activities at 15%, and cost also worth 15%. For calendar year 2021, CMS proposes to increase the performance category weight of cost to 20% and decrease the quality category weight to 40%. For the quality performance category, the score is earned from 6 measures selected by the eligible clinician. There are over 200 quality measures to choose from, including ECQMs. The reporting period for this performance category is for the full calendar year or the full performance year. For the Promoting Interoperability performance category, the same 6 measures in the PI program for eligible hospitals apply here, with the same point value distribution and score calculation. The reporting period is also continuous 90 days, and use of certified EHR technology is required as well. Eligible clinicians do not need to submit any data for the cost performance category. CMS uses claims data to assign the cost score for eligible clinicians. And for the Improvement Activities Performance category, eligible clinicians select 2 to 4 activities for more than 100 MIPS improvement activities categorized into high and medium weighted items. Data collection is required for a continuous 90-day period. Scores calculated for each performance category make up the MIPS final score. For calendar year 2020, data submission period is between January 4, 2021 and March 31, 2021. For more information about the Merit-Based Incentive Payment System, Quality Payment Program, Promoting Interoperability Program, and electronic clinical quality measures, here are some useful websites that you can go to. You can also do a Google search with the titles provided here to access these online resources.